This is the patient who is a 7-year-old child who presented to us with acute chest pain and shortness of breath and loss of consciousness for 2 days, and he was admitted on 19th March 2014. When you examined the patient, the baby was 7 years old. His pulse rate was 48 per minute. BP was very low and he was sweating heavily. When I took an ECG, it showed that there is evidence of acute heart attack in a 7-year-old child with a pulse rate of 48 per minute. We did the blood test and echocardiography, which confirmed that the patient has acute myocardial infarction, which is commonly described as acute heart attack. So this is a very rare case of acute heart attack in a children of 7 years of age. When we saw the old medical history, he was admitted 1 year back in the February 2013 with history of fever, redness of the eyes, redness of the skin, and changes in the nail, and the fever persisted for 16 days in 2013. He was treated with intravenous immunoglobulin and aspirin, and the disease was diagnosed as a Kawasaki disease. Just to point out that the Kawasaki disease is a disease which is first described in children in Japan by Dr. Kawasaki. It initially involves with fever, redness of the eyes, redness of the mouth, and changes in the skin, which just like mimic a simple viral fever. But the unfortunate part of this Kawasaki disease is that it involves the heart in 20 to 25% of the cases. Those who are not treated early within 10 days of symptoms, and 4 to 5% of the cases, those who are treated with intravenous immunoglobulins and aspirin. In fact, this child was treated with medication at that time in 2013, but unfortunately after 1 year, 2 months, he developed acute heart attack because of the previous Kawasaki disease. When we examined the patient, we saw that the patient was very sick. We immediately took the patient to the cath lab, catheterization laboratory. We put a life support system known as temporary pacemaker to improve the pulse rate of the child, which increased from 48 to 70 beat per minute with the help of a temporary pacemaker. Then we did a coronary angiogram, which showed that there is a blockage of the coronary artery of the left side in 2 places. At one places it is 100% blocked, which caused a heart attack 2 days back, and in one more arteries which are blocked almost 99%. And one artery was showing a coronary dissection, which was not reported earlier in Kawasaki disease from India, and will be the first person to report the dissection in coronary artery disease in Kawasaki disease after 1 year, 2 months of the onset of symptoms.